Medica live series. So today's remedy is ALOE SOCOTRINA. So let us decode the remedy. So Phatak in his introduction tells about us this remedy, about it is a venous remedy. Venous remedies in the Materia Medica. It has a center of action on abdominal venous congestion, rectal relaxation, pelvic heaviness and sense of insecurity. It is not a diarrhea remedy, it is a remedy of venous failure and loss of tone. So, ALOEs restores the physiological equilibrium when symptoms are confused and mixed. So, core and essence totality of the ALOE SOCOTRINA is patients having feeling that heaviness inside, dragged downward feeling, full loaded and congested feeling, unsure of bodily control. So there is a loss of tone, not a inflammation. ALOE is the remedy of downward pull and loss of control. When gravity seems to act inside the body, think of ALOEs. So central pathology on the abdominal vein. So ALOEs act prominently on the portal system, liver, colon, pelvis, and there is in these organs venous congestion. That venous congestion leads to fullness, heat, heaviness, relaxation and oozing discharges. So this explains why in the ALOEs there is piles, prolapse, sudden stools, pelvic dragging, congestive headache. So ALOE is not a spasm, it is a relaxation from congestion. Mental symptoms, ALOE is not, patients are irritable, dissatisfied, withdrawn. They angry on himself, life feels like a burden for them, dislikes people, repels company, disinclined to the mental work, thinks that I may die soon, trembles from music and sudden noises. So this is a venous irritability, not a hysteria. In physical general, the constitution of the ALOEs people are weary people, aged patient, old beer drinkers, sedentary patients with sedentary lifestyles, bad effects of long sitting. Sensations are very important. We must have to remember the sensation of ALOEs. These are the congestive sensation, that is sensation of fullness, sensation of heaviness, sensation of dragging, sensation of downward pull, and very important is sensation of insecurity. So loss of tone is the keynote of ALOEs. Then move downwards to the modalities of the ALOEs. Characteristic modalities of the ALOEs are heat, hot damp weather, aggravation from heat, hot damp weather in the summer, aggravation early morning, after eating or drinking, after dysentery, and in the evening. So, and emulsions are open air, cold application, passing the flatters, closing the eyes, tea or stimulants. So, heat aggravates, cold relieves the venous congestion of ALOEs. So, in particular symptoms of the ALOEs are head symptoms. In the head alternate with piles, headache alternate with lumbago, and abdominal complaints alternate with lumbar complaints. So, head symptoms are heavy pressure on the vertex, forehead ache, must close the eyes or must partially close the eyes to relieve the headache, vertigo with insecurity. So alteration is the clue for ALOEs. Rectum, the rectum is the main core of action of ALOEs. So in the rectum, key idea is rectum is weak, cannot retain the content. Rectum is weak, cannot the retain content, sense of insecurity. So patient may say that I must go immediately, I don't know if it is gas or stool. So, this is the uncertainty and insecurity of the ALOE. So, the Phatak describes ALOE as a rectum is relaxed, sphincter tone is lost, and control is uncertain. This produces the most characteristic feeling of sense of insecurity. So, patient says that I must go immediately. I am never sure it is gas or stool will pass. I cannot trust my bowels. This is not urgency from spasm, it is urgency from weakness. Characteristics of the stools are very characteristic, variable, mixed, confusing as to the pulsatilla, watery, lumpy, mushy, gelatinous, bloody, mucus mixed, solid stool is specially involuntary. The stool pattern is chaotic, just like a venous congestion. So, key clinical points or characteristic points of the stool symptoms are stool accepts with flatus, stools accept while urinating, stools and flatus are hot. This is a peculiar sensation of ALOEs. Burning in the rectum after stool, pulsations in the rectum after eating. In the ALOEs, rectum leaks before the mind can decide. So, urging is the characteristics of the ALOEs. ALOE has sudden, irresistible urging, weak rectum with congestion. So, this is a ALOEs. In the prolapse and piles condition, ALOEs produces prolapse of rectum, piles like a bunch of grape, which is also characteristic. Purple congested piles, piles better by cold bathing, burning and stitching prevent the sleep. So, characteristic is cold relieves the pile symptoms of the ALOEs because the contracted vein relieved by cold application. If the piles are better by cold, think of ALOEs strongly. In children, the characteristic observation we must see in the mother will say that the child goes around the house dropping a little hard round marble like stools. So, this is the characteristic. This shows that ALOEs has weak rectal control, loss of coordination, incomplete evacuation. So, ALOE is not only about for the adults, it is for the weak rectal tone of children. After eating symptoms are the characteristic and which are helpful for prescribing the ALOEs in the IBS, irritable bowel syndrome. So, in the urging immediately after eating, this is a characteristic. Pulsation in the rectum after meals, hungry again after stool. So, this triad is very important for making the prescription of the ALOEs in the irritable bowel syndrome. The venous congestion increases after meal. So, these symptoms appear. We must ask the patient of IBS to confirm the ALOE as do you feel urge to pass stool soon after eating? If patient says yes, and with that pulsation and hungry again after stools may confirm the ALOE. Also in the IBS mucus is present, so we must differentiate the other remedies with that. So characteristic of ALOEs are discharges are thick, jelly-like, gelatinous, seen in the stool or in the postnasal drip or in the rectal oozing. Whenever we see the gelatinous discharges, think of ALOEs. We must compare it with the graphitis. So, urinary and rectal congestion is a key to differentiate the ALOE. While passing urine, sensation of stool will accept. Incontinence in the aged, enlarged prostate with rectal involvement or rectal weakness. So, prostate complaint with rectal involvement, we must think of ALOEs and differentiate it with on other remedies. This shows that pelvic floor relaxation, not a bladder disease alone. So, aloe is the remedy of rectal weakness with sudden urging and insecurity. When the rectum gives away before the will, aloe has to work. In the female genital system, also uterine congestion remedy. So it has heavy congested uterus, dragging downward sensation, labor like pains felt in the groins and hips, aggravation standing and aggravation during menses. Menstrual features of the aloes are also characteristic. Menses too early, menses last too long, climacteric hemorrhages, pelvic fullness before bleeding, relief after flow started. Leukorrhea and postpartum status of the aloes also indications. So, leukorrhea is bloody, mucus mixed, preceded by colic. Phatak importantly notes that dysentery after parturition is the keynote of aloes. We must think the patient having parturited and then have started dysentery. Again, this shows that pelvic congestion, rectal weakness and post-delivery venous overload. In urinary system, incontinence of ages, enlarged prostate while passing urine, sensation of stool will excep. In back and lumbar region, aloe has strong affinity towards the sacrolumbar region as it is as seen in the aesculus. So, key symptoms are lumbago, pain in sacrum, aggravation while sitting, better by moving about. So, alteration complaints is the also key as we discuss is headache alternates with lumbago, headache alternate with piles, abdominal complaint alternates with lumbar symptoms. So, another is general heat and circulation. So, general heat sensation, internal heat, external heat, heat in the rectum and hot stool and flatters. Also, it is better by cold application and cold open air. So, this is a heat of venous congestion, not of the fever. In the sleep, dreams of soiling himself, fear of losing controls, rectal insecurity. These are these are the dreams of the aloes. In respiratory symptoms, winter cough, itching in the throat, cough on sitting downward and standing up, pains from the liver and chest. So, now we have to differentiate the many more remedies which are closely related to the aloes. So, the first remedy we must compare with the aloes is the podophyllum. So, both remedies have diarrhea, early morning diarrhea, urging, but nature of the stool and the rectum is completely different. So, as in aloe, rectum is weak, relaxed. Patient rushes because of he cannot trust on the rectum. There is a constant sense of insecurity, the feeling that stool may escape any time. Stool often passes with flatters during urination and without control, with hot feeling in the rectum. So, podophyllum is not a weakness of the rectum, it is a violent activity. Due to that, stool passes forcefully, gushing profuse and drives the patient out of the bed. This is a not insecurity, but it is a violent expulsion of the stool. So, in the stool, if stool falls out, then is aloes. If stools are thrown out, it is a podophyllum. So, another differentiating remedy is aloe with sulfur. So, both remedies have heat, piles, burning and morning complaints, but source of heat is different. Aloe heats come from venous congestion. Piles are dark, pulper, grape-like, better from cold application, and patient feels very heavy, worn out and burdened. In sulfur, the heat is of metabolic, constitutional, and reactive. Burning is intense, soul burns, head feels hot, heat aggravates, sulfur patient mentally is active, philosophical, and the key is differentiating as the aloe has venous failure and sulfur is metabolic overactivity. So both remedies have differentiating characteristic, but the common thread in these two remedies is this aloe's complementary remedy is sulfur, or acute is aloe, chronic is sulfur. In the piles, my one of the teachers who used to prescribe many of the patients of the piles only aloes and sulfur. The prescription is very simple. He gives 4 to 5 doses of aloes 30 daily, and after a gap of 5 to 7 days sulfur 1 m. So in a month 1 or 2 doses of sulfur 1 m, and other days in the week 2 to 3 doses of aloes. This gives immense results in many of the cases I have seen in my student life, getting results with the only these two remedies, aloes and sulfur. So in simple prescribing 3 to 4 doses of aloes daily, then gap of 2 to 3 days and give sulfur 1 m. Then again gap of 4 to 5 days gives aloes 2 to 3 doses and sulfur 1 m, and see the results. You may have great results with these two combinations. Another remedy we must discuss, or we must describe, differentiate with aloes is Nux vomica. Both have rectal and digestive complaints, but their tone is opposite. Aloe's rectum is over relaxed, stool except involuntary, and is strong, staining, only weakness and loss of control, while Nux vomica rectum is spastic and tense. There is constant urging, but stool does not pass easily. The patient strains and feels incomplete evacuation. Mentally, aloe is very dissatisfied, while Nux is driven personality, ambitious, irritable, type A personality, night watching personality. So, aloe is weakness, Nux is tension. Another remedy we must differentiate with aloes and sepia. Both have female complaints, but aloe has pelvic heaviness due to the congestion. There is dragging, fullness, and heat. Cold relieves all complaints. Rectal symptoms are prominent along with the uterine symptoms, while sepia has bearing down due to the exhaustion and hormonal depletion. Exercise relieves the sepia's complaints. The pattern patient is indifferent and rather than irritable. Rectal insecurity is usually absent, and the key difference is aloe has venous load and sepia has endocrinal exhaustion. Another remedy is lilium teak. Both remedies have uterine heaviness and bearing down sensation. In aloes, the rectum and bowel symptoms are come first. Pelvic heaviness is accompanied by stool and insecurity of venous congestion. The lilium teak has mental excitement dominates the all complaint. The patient feels she must support the uterus, crosses the leg, or press the upward. There is marked mental hurry and emotional intensity. So, aloe has rectum plus pelvic complaints. Lilium teak has uterus plus mind complaint. Another remedy we must differentiate is the phosphorus. Both have rectal bleeding. Aloe's bleeding is dark, congestive, associated with piles and heaviness, and cold application relieves. Phosphorus bleeding is bright red due to the capillary fragility. There is anxiety, weakness, thirst for cold drinks. This is of the phosphorus. Aloe bleeds from congestion, phosphorus bleeds from fragility. So, in the remedy relationship, Dr. Phatak described complementary remedy of the aloes is sulfur, as sulfur often follows well to the aloes, as I have already told. Why this happens? Aloes unload the venous congestion, sulfur re-establish the metabolic balance. Clinical sequelae that congested, heavy, insecure phase, aloe is indicated. Reactive, burning and functional phase, sulfur is indicated. Aloes prepare the ground for sulfur to complete his work. Another related remedy that Phatak described is podophyllum. If stool becomes forceful instead of weak rectum. Sepia is for when pelvic symptoms are dominant with rectal insecurity. In Lilium tick, mental excitement overtakes the congestion. In Nux vomica, it is spasm replaces the relaxation. So, the prescribing totality of the aloe is sense of must the core symptoms we must remember, or we must have these symptoms to prescribe aloe is sense of insecurity in the rectum. Second is urging after eating, urging sudden urging after eating. Third, stool except with flatus or urination. Gelatinous mucus stool. Heaviness and dragging sensation in the pelvis. Piles are bunch of piles like a bunch of grapes. Aggravation from heat, amelioration from cold. Alteration of the complaints. Head complaints alternate with back or rectal complaints. Irritability, dissatisfied, weary mental state. So, if rectum plus pelvis plus congestion plus insecurity is present, it is a clear cut indication of aloes. Rectum, pelvis, congestion and insecurity are the four words that have the core or central theme of the aloes. Potency, in the potency selection, 30 and 200 potency is very useful. In sometimes, if the all symptoms are clearly indicated, in cases of irritable bowel syndrome, we must use in 1 potency. So, golden pearls from the clinical practice is that of aloe stools are uncertain, not violent. Aloe stools are uncertain, not violent. Aloe has urgency from weakness. Aloe has urgency from weakness, not from irritation. Aloe's woman complaints of weight, not a pain. Aloe's improves with cold, aggravates with heat. Aloe's patients have feeling of burdened by their own body. So, this is all about aloes. Also, in 3 to 4 words, insecurity, heaviness, and congestion. So, these are the core symptoms of the aloes as we discuss. So, this is all about aloes. Thank you for patience listening. We will join us in the next episode. Thank you very much.